All right, let's get to the big story here tonight. For the past 2 months, we've been telling you, and you know, the Delta variant has overwhelmed hospitals in Oregon and in Washington and frankly, all over the world. And back in August, you might remember we visited the ICU at OHSU in Portland. And we saw younger people, mostly unvaccinated, fighting for their lives. Well, tonight, we have the story of one woman who was near death in that ICU when our cameras were there. But today, she's out of the hospital and recovering. Christine Pedawanich has her story.
And I just saw this video.
The reality is that out of all of our patients, they're all COVID positive. The reality is a lot of them will die.
That said, overwhelmed, Oregon's ICUs, and I'm like, let me just watch that. And then I saw myself. I just saw my hair. It was longer then. And I had 2 stuffed animals that was given to me in the hospital. I had never seen myself like that. Kind of freaked me out a little bit.
Miranda Reich says this is her. Just 2 months ago, 29 years old with COVID-19, hooked up to a ventilator and an ECMO machine, what healthcare workers have described as the highest form of life support. It's a last-ditch effort to save a life. Back in August, KGW went into 2 Oregon ICUs as the Delta variant surged across the state. One of them, the medical ICU at OHSU in Portland, where more than a dozen people with COVID lay in a coma. Rich says she was one of them. In early September, Rich woke up. She beat the odds.
I was lucid enough to ask one of the doctors what happened to me. And she told me about the ECMO, about it being my last shot, and basically I was borderline dead without being called dead, and that I was a miracle.
After she got home and watched the video, Rich decided she wanted to tell her story.
And I was like, maybe they need to know that somebody made it, that somebody out of the ICU actually did make it and is alive. I don't want to be known as the heartbreaking case of a young woman who was unvaccinated and covered in tubes.
She's recovering with her family in the small town of Hamilton, Texas. Her ordeal started in late July when she, her husband, his grandparents, and another relative visited family in Oregon.
But then we all started feeling bad.
She ended up being admitted to a hospital in Roseburg, where she found out not only did she have COVID, she was anemic. After several days, Rich says she was airlifted to OHSU. Doctors were frank with her family.
The doctors even told my mother I was not going to leave the ICU. They were already warning her I was probably going to die.
But she didn't, despite being unvaccinated with anemia and pneumonia associated with COVID-19. Rich says her mom and husband got COVID early in the pandemic. She didn't get sick, so she thought she was safe.
And I just never thought it was going to be me. But like I said, most people don't think it's going to be them until it is.
But now she's vaccinated.
Like I said, I can't afford to get COVID again.
And also believes the vaccines helped keep her 87-year-old grandmother-in-law and 92-year-old grandfather-in-law safe when they got COVID. For now, Rich is rebuilding strength in her body and lungs, recovering with the help of family.
She's a miracle, an absolute miracle, and she's a fighter.
Meantime, she has constant reminders of what she endured.
I had a trach. The other tubes were shoved in me on either side.
Scars that will stay with her forever.
My husband says, wear them with pride because you fought a battle that not many people have won.
And these stuffed animals, also seen in her hospital room, are reminders too. The pink one given to Rich by her mother.
This one is a mystery. When I was at Mercy, somebody gave it to me, and I don't know who.
Rich wants her story to give people some hope.
I hope they hear that it is beatable, and I will be forever grateful for OHSU for what they did. By all accounts, medically, I honestly should be dead, but they fought for me, and they saved my life. I feel okay. I've been given a second chance, and I don't want to waste it.
Christine Pedawanich, KGW News.